All right, we can get started. My name is Jessica Raimondo. I'm the Communications Director for UFCW. Thank you all for being on today. This is a national press call on the coronavirus impact on grocery workers. You are going to hear from UFCW International President Mark Perrone. He will highlight the devastating impact the coronavirus is having on America's grocery workers, as well as discuss the letter we sent to 49 companies about hazard pay. You are also going to hear from grocery workers from across the United States who are on the front lines of this crisis. We are going to leave 10 to 15 minutes for questions after everyone's remarks. If you'd like to ask a question, just let us know in using the chat feature and we will call on you. If reporters would like to follow up with members or with Mark after the call, please reach out to Abraham White. And also this call is going to be recorded and Abraham will send this around to all members of the media after the call. And with that, I will turn it over to UFCW International President Mark Perrone.
Thanks, Jess. And I want to thank everybody for being on the call today. You know, as you know, since the first day of this pandemic, America's food and grocery workers have been placed on the front lines of this national public health crisis. They're deemed essential by our elected leaders, including the President of the United States, but most importantly, the companies that they work for. By any realistic measure, the risks that these workers, both union and non-union alike, they face and those challenges that they faced has not diminished in any way, shape, form, or fashion. The threat of this virus is still very real in our communities and in the stores that we visit. These workers, quite honestly, are asked to wear masks and gloves. The companies tell them to sanitize their work areas as well as the other areas around the store. You know, on any given day, these workers must interact with thousands, and I do mean thousands of customers walking in and out of these supermarkets. You know, simply put, the threat of this virus is real across every grocery store in America. And yet, aside from a handful of counties and states, there's still no state policy that enforces social distancing or mask wearing, nor most of America's largest food retailers, they're not enforcing social distancing or mask wearing either. Taken together, this health threat facing America's grocery workers has by no means in any way, shape, form, or fashion diminished. Today, our estimates show that at least 68 grocery workers in companies that we represent have died. Over 10,000 have become sick or exposed to COVID-19. That's a 200% increase in just over the last 5 weeks. Even worse, not one single of America's largest retail food companies like Walmart, Amazon, Whole Foods, Trader Joe's, Aldi's, or even Kroger's has released internal estimates on the number of their workers that have died, become sick, or have been exposed. I want you to think about that for a second. Nearly 2 months into this pandemic, some of America's largest companies have refused to release this information, or in the case of Amazon, have attempted to silence workers who are brave enough to speak about it. If there's one thing I'd like for you to do, and I'd ask all the media to do it, is ask the question and demand the information. Because here's why this information matters. Some of the same companies like Amazon, Whole Foods, Kroger's, and others have recently announced that they're going to end what they call hazard pay, appreciation pay, or hero pay, whatever you want to call it, it doesn't really matter. In the case of Kroger's, they eliminated the $2 an hour hero pay. And you're going to hear from some of these workers why this matters and what they face in their own words, not mine, but theirs. In all these cases, this pay cut is essential to these workers, and it's being taken away even though these respective companies are experiencing record sales and profits and higher productivity. The pay cut is being implemented even though the grocery workers are still dying, and not a single state major city, for that matter, or county, has returned us to anything resembling the pre-COVID-19 normal. These companies, by eliminating this hazard pay, ignores what the American people know, that this virus is still very much a threat, and especially for those workers who must interact with thousands of customers every day. What's being even more troubling is that it speaks to this particular issue that we have to deal with, and that is there are two Americas that are now emerging in the post-COVID-19 world. Those that can work from home and those that can't. It's simply not right that we're asking America's grocery workers to work to protect our food supply and then take a pay cut. If companies like Walmart, Amazon, Whole Foods, Trader Joe's, or Kroger's truly believe that this threat has passed, then they should be willing to say that publicly to the media on the record. And until then, these companies have a responsibility not only to protect their workers, but take the appropriate steps to protect our food supply and public health. Now, we've sent a letter to the nation's CEOs of the largest national and regional, specifically, that we ask that these workers be provided with sufficient PPE, because we're still hearing some horrific stories of workers that are having to reuse masks or having to purchase their own sanitation wipes in order to do the sanitizing in the stores. That social distancing and masks are being required in many cases for them, but not the customers. And the companies should enforce these policies and not expect these grocery workers to become the public health officer of the county or a security guard that the company should be supplying on their behalf. But most importantly, that the so-called appreciation hero hazard pay should continue until this terrible threat has actually passed. Now, we hope that these companies will recognize that when their workers face higher risk, they should be paid more. As I wrote in a letter that I sent these CEOs, I hope that each of them recognizes the following facts: that these food workers did not stop becoming heroes on one particular day. They're not necessarily facing fewer hazards, and they don't deserve less of our appreciation because they're still going out there every single day. And while we hope that some of these companies do change, and we've heard some of them have, we hope they follow the lead of other national companies like Albertsons, Safeway, Ahold, Myers, Stater Brothers, who've acted responsibly in extending this pay. And we're preparing options to ensure that every American knows who stood with their workers and the families and who did not. You know, our greatest asset in this fight to protect the food supply, to protect these workers, has always been the customer, the American consumer. These companies may not always listen to us or even their own workers, but they are in fact forced to listen to their customers. And to that end, we're going to be launching two initiatives in the coming weeks to protect the workers and the food supply as well as the public. First, we're going to build our campaign to encourage customers to wear masks and to shop smart. Many of you already know of that campaign. And to mandate the need to wear masks in key areas like supermarkets. And second, we're going to be launching a campaign to educate the American consumer about which grocery and supermarket companies are protecting their workers and which are not, and to encourage the American consumer to speak out to these companies and to tell them that they need to provide PPE and hazard pay to all essential workers that are having to come out of their homes to support us all. We'll let you know, and all the media know, about how those initiatives are coming in the very next few weeks. And I want you all to hear from the real life experiences of some of our members about the challenges that they face and the real impact that eliminating this hazard and heroes pay has had on them and their coworkers. So Jess, I'd like to turn it back to you for our first speaker.
Thank you, Mark. And if everyone could please mute their phone lines, I'm getting a fair amount of background noise. Our first speaker, our first grocery worker speaker is Stephen Brown, and Stephen works at Kroger in Columbus, Ohio.
Hi there, how you doing, everybody? Again, like she said, my name is Stephen Brown. I am 30 years old. I've been working for Kroger for just under 13 years. I have been in this business for a while and met my wife here, grew my family here. So this is a place that's really important to me for a lot of different reasons. I just want to say that I think we're all experiencing a bit of a new normal these days. Me personally, I know I am, with the effects of COVID-19 in our stores. I have noticed getting ready for work has become a brand new ordeal, with making sure that I have cleaned the uniform that I had taken to this place that once could not be so dangerous every day, to make sure that I have been protected for myself as well as my family. To look at the partitions that are placed at every registers to kind of disconnect me from my customers, the mask that I need to wear and apply to check myself as well as the people that come in and my coworkers. It's a lot to adjust to. It is different, but it's understood. So I am willing and happy to comply with these ordeals, just to make sure that I can protect my community as well as myself. These are changing times. But when you look and you see how dangerous this becomes, the number of cases that have been confirmed, the lives lost, and you know that you have to continue to risk yourself to not only to provide for your own family, but for your community. When a company like Kroger's decides to give you something in the line of appreciation, or hero pay in this case, for your services, you feel that you are the essential employee that they claim you are. I know that that's how I had been feeling for the first couple weeks. But when they initially announced that they were going to take away that hero pay, I began to feel a little less appreciated as they claimed that they were of me. Yes, swiftly they did rescind that action and extend that hero pay a few more weeks. But clearly this pandemic is still going. It's still going strong, it's still hard, and we're still all trying to get through it. So when you tell me that there's no way you're going to extend it further, as though everything is over, it kind of just brings the question of what's changed, what's different. And if you're taking away this pay that has been essential for my family personally and getting through this pandemic, I do wonder what's coming next. When the protections that you have put in place gone away? When do the sanitation items that you have been supplying us with go away? The sanitizer go away? When do these things that we've come to become used to not only protect ourselves, but the people we serve, start to dwindle? If you feel as though the situation has dwindled enough that you don't need to pay us the pay that you had already given. I don't understand it. I can't agree with it. And I can already see the decrease in morale in just the coworkers that I've known for so many years in this short time, based on the decision that you've made. I'd ask you to reconsider that decision, Kroger, to reconsider the true appreciation you have for your workers and for me, and understand that this is not a act of looking for more monetary gain, but for you to understand as our company that we just want to feel the appreciation for the risk that we take every day, and understand that we are not here to cause you any grief or problems. but to understand that we are in this together. And in that end, we need to feel that we're in this together. Thank you.
Thank you, Stephen. Next, we have Deb Griffin, and Deb works at Kroger out of Lawrenceburg, Indiana.
Hi, my name is Debbie Griffin, and I am 41 years with the Kroger Company. Like she said, I am from Lawrenceburg, Indiana, part of the Cincinnati division. I have been working more hours since all this has started. We do have a lot of customers that come in the store that are concerned for our safety. And they just ask us every day, please stay safe, please stay safe. Also as well, I did have one customer who came in and she was coming in my line, and I'm a cashier, and I am grateful for the Kroger Company for putting up the plexiglass, and we do have our mask and we do have our gloves. But the one customer who came in and she was coughing in my line, and as I was starting to back up, she said, don't worry, it's just a smoker's cough. And I said, well, and I'm thinking to myself, I don't know if it's a smoker's cough. I don't know what's going on here. So immediately after she was done, I closed off, I sanitized everything. I changed my mask, I changed my gloves, and I wouldn't let anybody else come in my line until the whole station was sanitized. And still, I did not feel safe. I feel like I'm still at risk, that I could be taking this home to my children, to my grandchildren, to my spouse, you know, to any other family members that I come in contact with. And yes, we are very much still at risk. And I wish the Kroger Company would enforce the fact that the customers would wear masks when they come into the store. I think that would greatly ease our mind. But yeah, for them to take away the hazard pay or hero pay, whatever they want to call it, I think really is unjustified. We put ourselves on the line every day by coming in there, because we don't know who's coming in that store. You know, we want to keep ourselves as healthy and safe as possible. But yes, we do go to work every day. So if Kroger would please reconsider this hazard pay, we would greatly appreciate it.
Thanks, Deb. Next, we are going to hear from Christine Holtham, and Christine works out of Kroger in Lansing, Michigan.
Good morning. My name is Chris Holtham. I'm a meat manager for the Kroger Company, and I've been a member of the United Food and Commercial Workers Local 876 out of Detroit, Michigan for the last 35 years. Every morning I get out of the car and take my last drink of coffee before I mask up for the day. I never thought that that last cup of coffee would be such a luxury. Some days I wear a mask 8 to 10 hours a day, 3 to 4 masks a day. It's not pleasant, but it's the right thing to do. I spend the first half hour of my day preparing my workstation, my public computer, my mouse, my phone, my touch screen, my handheld computers, my door handles, display cases, and any carts I may use that day. I do all of this with Clorox wipes and Lysol spray that I purchase myself so that I can keep myself and my staff safe. What the pandemic has taught me is that we all have to protect ourselves, especially when you're working with the general public. Social distancing is not easy. It's a learned behavior, and it takes practice, effort, and common courtesy. A simple pardon me can go a long ways. People approach me every day, hundreds of people a day, walk right up to me with or without a mask. Everybody shops on their phone, so they want to show me their phone. They want to push their phone at me. They enter my personal space zone because, quite frankly, my aisles are only 6 feet apart, and everybody is funneled down my aisles around displays. So while the average customer might only spend 20 to 40 minutes a day with the maximum of 50 to 100 customers a day, I see 2,000 to 3,000 customers a day, and they all funnel right through my department because we still keep the milk in the back of the store. When Wearing a mask has become a public issue. It is not required, but recommended by my company. At first, I would offer masks to those without one, and most people would take them graciously and say thank you. But now masks have become a political war. The employees are downright scared and afraid to ask somebody to put on a mask because of the retaliation we get from it. Just last week, a security guard in Flint, Michigan was shot and killed because of a confrontation he had with a couple entering a store. It wasn't my store, but entering a store without a mask. It's a big issue. Kroger wants to return to normal. This is not normal. Preparing for battle every morning is not normal. We are open to the general public. Anyone and everyone, 2,000 to 3,000 people per day. They're not required to sanitize. They're not required to wear gloves. They're not required to wear a mask. Our customers are not screened. And I see hundreds of people a day without a mask. Hundreds of people a day without a mask. Just funneling into my department. We are total targets, sitting ducks for the virus. And that risk is why we deserve hourly hazard pay. We're not heroes, we're sacrificing. This is a risk that we are doing. We deserve hazard pay until I no longer have to put on a mask to work at a grocery store. Thank you for your time.
Thanks, Chris. Our final speaker is Raquel Solario, and Raquel works at Ralph's out of San Diego. And Raquel, before you start talking, I think you might have to unlock your phone because you are...
Can you unlock my phone? Is that better now?
No, you're still showing up kind of the wrong direction. There we go.
Okay,
Thank you.
you're welcome. Better?
Better.
Okay. Good morning, my name is Raquel. I work for Ralph's. I've been with Ralph's for 36 years. I'm a sales manager. I have 5 people in my household who work for Ralph's with a total of 84 years of service. We work over 250 hours a week for Ralph's. 2 meat managers, 1 sales manager, 1 front-end manager, and 1 pickup person. 2 of those members are my children, 24 and 21 years old. We're not heroes. We're far from heroes. I don't have a cape. This is my cape every single day. They asked us on May 5th to dress up as heroes. It's Hero Day. I'm so happy I was off. I don't know who decided to do that, but it was in poor taste. People are suffering, people aren't dying, and they want us to dress up as superheroes. Not right in my book. Then on March, sorry, I have to get my glasses. On March 16th, they sent us this letter saying it was critical for us to work, national public health. So what are we? Heroes or essential workers? Tell me, Kroger, what are we now? I enjoy my work, love my customers, love my members that I work with. Have a lot of thankful members. It's customers, I'm sorry. Thank you for coming in, thank you. Then I get those other customers that tell me that I'm lucky to be working. You're lucky to have a job. Don't know how lucky I am, because I hear a lot of people get way more than me on unemployment. To me, lucky is when you find a penny. To me, lucky is when you hit a jackpot. I'm not lucky. I come to work every day. Where was I on Easter? I was here. Where was I on Mother's Day? I was here. I am here every single day, 6 days a week, for the last 8 weeks. I don't know why they would be taking our hazard pay away. So Kroger, for the 460,000 associates you have, please do the right thing. More than ever, our community needs us, more than ever. So more than ever, we need Kroger to back us up. Help us. I'm sorry. Our jobs matter. Our jobs matter so much. For myself, for my 5 members in my household, but our health matters more. Thank you again.
Thank you, Raquel. Now we are going to open it for questions. Our first question comes from Dave Jameson from Huffington Post.
Hey guys, thanks for doing the call. Really appreciate it, especially the workers who've spoken up about this. I was wondering if anybody could give us a rundown of what chains where UFCW represents workers. Is there anyone other than Kroger who is already phased out any hazard pay? And kind of where are the other employers on this right now, or have they just kind of temporarily extended it? Is the deadline unclear? Any kind of detail on that would be helpful. Thank you.
Mark, we'll let you take this, but you are on mute.
Yeah, I'm unmuting now. Most of our major employers, the largest employers, have in fact extended. Look, the challenge, and I'm going to answer Russell Redmond's question at the same time because they're similar. Kroger did the bonus pay initially, and then went to the $2 per hour additional pay after the other employers had done the $2. Now, the significance of the $2 an hour is this. It's paid on every hour worked, whereas the bonus pay is not. So if we've got members like Christine or Raquel that's working 60 hours a week or 6 days a week, by going to the bonus pay, she's now making less money. If you think about Christine, look, at every location, you have different issues with different store managers, right? And in her particular store, she's having to buy her own sanitation wipes because she doesn't have them in the store. And so that additional pay is significant to these workers. They shouldn't have to do that realistically, but that's what's happening. And so we have Kroger's that have gone to the $400. Albertsons, Safeway, our major employers like Ahold on the East Coast, Stater Brothers, Myers has extended, and when I say Myers, I don't mean Fred Myers, I mean Myers in Michigan has extended through June, almost through the end of June. So, I mean, I think all companies are trying to figure out how they ultimately deal with this. Our position is this. Look, we believe that the virus is going to be here for a while. Now, it may die down in the summer, but it's going to come back. And when it does come back, it's going to be, again, it's going to be difficult to deal with. And we want to make sure that we ultimately establish, a change in how they deal with this hazard pay, because it is a hazard. Look at what's happened inside the stores with customers that won't wear masks. Look at what's happening when customers get frustrated, there's no toilet paper. Those sort of things need to be rectified in these stores, and those hazards need to be removed. Look what happens when you ask somebody to maintain social distancing. Those kind of activities either have to stop in order for us to feel as though that our members don't deserve that pay anymore, or the company has to do something in some way, shape, form, or fashion to take us back to pre-COVID-19 times. And so do I think that companies are starting to realize maybe they made a mistake with the customers? Well, yeah, I do. In fact, it's my understanding that Whole Foods just recently announced, since we started all this, has just recently announced that they're going to reinstitute the $2 an hour pay. So a lot of the work that the media is doing, quite frankly, and I commend you all for it, has been beneficial in order to make sure that these workers are being treated properly, whether or not they're in union stores or they're in non-union stores. And I think I don't want us to lose sight of that on this call. Now, I understand that I've got Kroger workers here, but it doesn't matter which company they're coming from.
All right. Our next question comes from Polly at Bloomberg Business Week.
Yes.
Polly, it's the question about the security guards.
Yeah.
Yes. So we're working on a story about basically worker safety and the presence of security guards, or whether the sort of workers themselves have kind of started to view themselves as security guards. There were a couple of violent incidents mentioned both by the workers, who I much appreciate being on the call, and by you, Mark. And I'm hoping that you guys can speak a little bit more to that. If there's pressure to put security guards into stores, or if there's pressure from the stores for their employees to act like security guards, and sort of what you see happening next, especially as reopening continues and we're going to see more shoppers in these stores.
Well, here's what I've said. In fact, I had a conversation with the CEO of Albertsons Safeway this morning before this call. And I told him that we needed security guards inside the stores. We have been pushing for that for quite some time now. And the reason being is that these workers should not, number one, they're not management. The consumer doesn't look at them as management. And we don't think that that's the best use of their activities anyway. We think that A, it should be a security guard, or B, it at least should be the managers of the stores that have some authority over the actual space, right? To be able to say to somebody, look, this is our store. I need you to wear the mask, or I need you to do the social distancing. Please do not, attack our worker because they're trying to ask you to do the right thing. We know that there's problems. We've seen it. We've picked it up. I was on a conference call this week with our communicators. We just had an incident where a worker's arm was broken because they had asked somebody to put a mask on. That kind of activity is uncalled for. And yes, we are calling for security guards inside these stores. The companies, at this point in time, I think are reticent about doing it for the following reason. They don't want to drive off their customers. I mean, they are more, at this point in time, they're more satisfied, in my opinion, with the increased sales than they are trying to protect the workers that are in there, as well as the other customers that are in there. And that has to stop. I see Christine shaking her head, but it does have to stop.
And Christine, might you be able to speak to this a little bit more based on the experience that you've had at your store?
Yeah, absolutely. When the mandated order came out from our governor the next morning, we offered masks. Kroger got in a lot of non-surgical disposable masks, and being that I wear my own mask every day, I thought it was okay to give away what was rightfully my masks. So I would go around to customers and say politely, "Sir, you need a mask you need to wear a mask to shop at Kroger." And most people will go, "Oh, I didn't know." Take the mask and say thank you. And I would respond with, "No, thank you. I really appreciate you wearing a mask." I had one incident where I asked a gentleman, "Sir, you need a mask to shop at Kroger?" He said, "No, I don't." I said, "Well, sir, it's kind of a mandated order and it's Kroger policy." He says, "It's not a law and I'm not going to wear a mask." I said, "Come on, sir. It's for my health, not yours. It's just a mask." And he turned and looked at me and said, "I don't give a damn about your health." It really took me back. Got to be honest with you, this last day I asked anybody to wear a mask. The response, the retaliation from people when you do ask them to wear a mask is it's both ways. Some people are just non-mask wearers. They have a purpose for not wearing their mask. they're not going to wear that mask. And I think a lot of it is just simple, maybe not knowing that it is a requirement to wear a mask. I see a lot of millennials, a lot of younger people not wearing masks. And again, most of the people, when I offer a mask, kindly take it. But you do have, it's become worse and worse. It's become political. It started out being a safety issue. Now it's a political issue. And believe me, if you ask somebody to wear a mask, it's like telling them to throw their gun away. So we're scared. People in my store are scared to death to even ask anybody to put on a mask.
So I think, Polly, I do think it's going to require, you know, a better understanding. And that's one of the reasons why we're doing the Shop Smart program. In fact, over the next week or two, we're doing a full page ad in the New York Times, and we'll be pushing it out further than that digitally, where we've got a group of leading scientists that are talking about why it is important to wear masks and how it will ultimately reduce the possibility of the transmission of the virus by 80%. Now, there's still 20% that's possible through contact. In other words, the virus gets on a surface, but that's the reason why Christine and the rest of the workers are wiping down all their surfaces and things. So, you know, we're doing everything that we can do to keep from transmitting the virus to the customer, but we do need the customers doing the same thing with us. The challenge has been, is because it has become politicized. And that is a problem when it comes to public safety. And that's something that we've got to deal with. And if in fact, the state's not going to deal with it, they're not going to do the enforcement. I mean, they can mandate it, but when it gets to the store level, if somebody walks in there, the challenge has been is that the companies haven't wanted to say anything to anybody. And especially when they get these responses like Christine's talking about, they don't really know what to do with that. And therefore they've just been, kind of taking a pass on it, unless you've got some person that's, feels pretty comfortable with walking up there and taking a firm position with somebody. I was looking at some of the there's one comment, Kristen Toussaint from Fast Company. Yeah, that's correct. Kroger's will now not seek repayment for the workers that they say that were overpaid. When they first initially did their first bonus, they went back several months into a time frame that was not a pandemic or COVID-19 time frame. Like they went back, in other words, for a part-timer, they were going to get $150 for working during the pandemic. But they went backwards and they looked at their hours back into February and the first part of January to figure their average hours. Would they be part-time or not? And so what happened is that those workers were going to get less money than, say, somebody that worked 40 hours. And somebody in the beginning stages that were going to work 40 hours, they were going to get $300. So, but they have now gone backwards on that, and they're not taking that money back from what I understand.
And Mark, the next question is from Veronica at NPR.
Okay. Is the written, or are you going to do it verbally, Veronica?
I can totally just read it off. So at the beginning of the call, you mentioned that there are 68 UFCW members that have passed due to COVID-related complications. Does the union know where these deaths have happened? Or have they been concentrated in any geographic region? Is there more information?
Yeah, actually, we do. We know that they were concentrated heavily in the New York, New Jersey area. So far it has been based off of where you had high concentrations in the market anyway. In some respects, I'd say the following. I think part of the reasons why we had them heavily in those areas at first you may recall there was a challenge by the government where they did not provide and had the PPE in place for the population. In other words, initially, the CDC said no masks. And the reason why they said that is because they didn't have enough masks for the healthcare workers, right? And they had done not enough preparation around that. And because of that, the CDC did this announcement, don't wear a mask unless you're sick. Well, that put our workers, quite honestly, at risk. And at the beginning phases of this, when this first started, I think more of our members in those areas were affected by that. And I think that created a pretty significant problem for us. Now, what had happened after that was that companies couldn't get the mask in the very beginning. They started looking for alternative solutions based on conversations that our health and safety people had with them and that we were having with them, which were, if you can't do a mask, can you at least get us shields? And that's how we ultimately started down that path. The deaths have somewhat died down some now. However, we don't have any statistics from any of the non-union food stores that are out there. We have heard numbers out of Trader Joe's that they had as many as 6, but we don't have as many connection points with those workers that as we do with our own members, if that makes sense to you guys, right? So as far as retail food, we think there's probably many more than the 68. We just know of the 68 that are associated with our membership at this point in time.
And Mark, that kind of leads us to our next question, which is from Ben Rubin at CNET.
Okay, so Ben's question had to do with, is it more along the lines of the particular area? Ben, let me say the following, because we represent packing and food processing. You know, Amazon has taken that position because Amazon is a warehouse operation, right? And warehouse operations are a little bit different than food stores for the following reason. You may have workers that are closely connected to each other because of the inability to create social distancing. It may be in the hallways that workers have to enter and check in. We've seen some of the work that has happened, say with GM. We know that we've had problems in packing houses because of the high volume air conditioning systems that are required in the food processing portion of those packing houses. We also know there's higher humidity in some of those locations because of that, the virus stays airborne longer and doesn't die off as quickly. So we do know that in some cases, from our perspective, we're trying to figure out which particular areas have a higher number than other areas of work. So in other words, we're trying to track, are our packing houses at this point in time, do they have bigger death rates and problems because of the number of people that become infected? Or is it our food stores because of the way that they're laid out? So we're tracking that information, and that's why we think it's important. We do have warehouses as well. We've got pharmacies, food stores. We have nursing homes, and we have some hospitals. So all those areas, we're trying to track that to see if there's a correlation between the numbers and how much PPE is provided to those individuals in our membership. That's why it's important to us.
Okay, our next question comes from Janet Nugent from Marketplace. And Janet, do you want to ask your question?
Yeah, first off, thanks guys for setting this up. I wanted to ask about the use of the terms like hero bonus and thank you pay versus hazard pay. Does the union have any concerns about it not being explicitly labeled hazard pay? And could that affect workers either now or in the future?
Well, look, I think it should be hazard pay for the following reason, is because the hazard, as I indicated a little bit earlier to you, is going to come back. We're going to see this thing in the fall, and I think we're going to see it much larger in the fall than we have now. Look, we have had an opportunity to get ahead of it. I'm afraid with the politicization of the mask wearing that come fall, there's going to be more of a pushback as it relates to the, people wearing masks inside a store. And if those hazards exist in the fall and our members have to go out and go face the public, while a bunch of people sit, and please don't misunderstand me, when a bunch of people sit behind a computer screen, and don't have to go to work, I think these workers ought to get extra pay. You take a bigger risk in investment world, you're going to get a bigger return. If you take a bigger risk in anything that you do, your hope is that you get something more for it. So I think it should be called hazard pay. Look, I think the whole hero pay thing was because, my personal opinion is, I think it ended up being a PR issue, right? They initially had an initial appreciation bonus, right? Stephen, isn't that right? The $300. Then they realized everybody was getting the $2, and they changed it to the $2 hero pay because they had to call it something else. And so they did. But now, my question to each and every one of you on the phone is this. Do all of a sudden, a person wakes up the next day and no longer they're a hero? Is that really how it works? Should it be hazard pay? Yeah. I don't think that somebody that does something above and beyond wakes up tomorrow and then finds themselves not important anymore. Raquel said it. She said it better than I can. I mean, all of a sudden now you're not, significant anymore. That's, I'm sorry, but that gets me a little bit hot under the collar. I apologize.
Our next question, and we're going to try to get to as many as we can before the end of the hour. Our next question comes from Chris from WSB in Atlanta. Do we have Chris? How about Kristen from Fast Company?
Oh, I think we already did. We did Kristen from Fast.
What about Susan from Detroit Free Press?
Hello, can you hear me?
Yes.
I was just curious as to what it's mandated here in Michigan that any, when you go out in a enclosed place, public place, that mask wearing is mandated by an executive order from the governor. And what are people like Kroger telling you why they are not enforcing it if it's a mandate from the government?
I think it happens in a couple of different ways. It depends on which area that the stores are in. Some cases, they're not saying anything to people. They're just not. Kroger's position, as well as a lot of the company's positions, is that they don't find themselves to be law enforcement. And what's happening is it's being pushed upon the members that are in there, because they're scared and they're asking people to put masks on to protect them. And they're getting this negative political answer back. And that's the challenge that we've got. That's the reason why we want security guards. We don't think that these workers ought to be the ones that have to approach people and ask them to do what the mandate is. If we don't get our hands wrapped around this, however, we're going to have a problem come in the fall.
Our next question comes from Sarah Jones at New York Magazine. Sarah?
Hi, thank you. So we know that working class people of color have been disproportionately harmed by the pandemic, no matter what industry they're working in. And with that in mind, I was just curious to know if the union is keeping a demographic breakdown of the food and grocery store workers who have died from the pandemic so far.
Not specifically. We probably have it at the local level, and we could probably put that together if you're really interested in doing that.
Our next question comes from Chris Otts from WDRB in Louisville.
Yeah, I was just wondering if we're hearing you actually calling on the grocery store chains to require that customers wear masks or gloves or other PPE, or to actually take their temperatures at the entrance. If not, how do you foresee this being enforced, and are you aware of any other national or regional grocery chains that are actually taking those steps?
Well, I don't know of anybody that's actually taken the steps to ask customers to be screened for their temperatures, but I will tell you the following. I don't necessarily think that's a good indicator anyway, based off the science. Look, I think this needs to be based off of science. It is clear that you're not going to necessarily show a temperature for a couple of 3 days before you might have a light symptom. And therefore, since you're not going to be showing a temperature anyway, you may already be asymptomatic and you're already in a position that you're going to infect somebody. So I don't necessarily think that is a good indicator about whether or not somebody should be, come into a store or not. As it relates to the PPE and wearing a mask, yeah, I think that I have already asked employers to require their customers to wear masks going in. As the president of the union, have I asked them to do that? Absolutely, I have. Have they shown concern about it? Yeah, they have. I've got plenty of employers that believe it's the right thing to do, but they believe it's become politicized as well, and they're concerned about it because they don't want to enter into the politics of it. Look, we know of companies that in the past have dealt with other serious political issues, like in the state of Texas. Is it okay to bring your AR-15 into the grocery store? That's been a discussion there. It's a discussion because it's been politicized. Should a person be allowed in a store that doesn't have a mask on when we're in the middle of a possible pandemic? I think that as a matter of public health policy, we should be willing to do that, especially if they provide the masks for the customers. I think it's totally appropriate. Has somebody required it? It's my understanding that Costco has required all of their customers that come into the stores to wear masks.
Our final question that we have in the chats, at least, is from John at Toledo Blue. I don't know if Mark covered your question already.
Yeah, somewhat they've covered it. I wanted to know from Mark if you've talked to chains about taking it out of the political realm and making masks as part of a term of service. It's well understood that no shoes, no shirt, no service. Have any of them thought about maybe turning it, with mask as well? No shirt, no shoes, no mask, no service.
John, let me ask you the following. Would you like to come to work for us? Because that's a great idea. I mean, seriously, John, thank you so much. But you're right. How's that any different? I mean, you wouldn't let me walk into your store naked. So why would we allow somebody in a pandemic to walk into a store without a mask on? Look, I understand the challenge of it. Look, it's a fine line in the retail food industry. People are concerned about margins and margins being really, really thin. But let me say the following. Whether or not it's wearing the mask or the hazard pay or whatever we're talking about at this point in time, sales are up by 30% over what they were last year, right? So sales are up, profits are up, sales per man hour is up, which means productivity's up, and it should not matter if we alienate a few customers about whether or not they got to wear a mask in or not. And if we're not going to protect our workers from the hazards that they face, then they ought to pay them for the hazards that they're facing. It's a matter of risk versus reward. I've said this 100 times. So, John, I will make that attempt to run that approach on the CEOs going forward and see if I get any different responses out of them.
And then we have our final question is from Russ Redmond at Supermarket News.
Hello.
Hi.
Hi. I just had a follow-up from Sue Salaski's question. What's the role of local law enforcement here? Can store managers or other store associates contact police if customers are threatening workers for they don't want to be forced to wear a mask?
Of course they can. You know, if it's a mandated order under the state, of course they could. There is no reason why they couldn't.
I mean, because I'm asking with the issue of security guards and so forth, shouldn't they just be performing some of this function?
Well, I'm sure they could if in fact the state has got that requirement. But whether or not the state has the requirement or not at this point in time, and as we move forward into the fall, because look, there are a lot of states, take the state of Arkansas, for instance, and other states from which I came from, they were very reticent about going forward and requiring any sort of mask wearing in the stores.
All right. I want to thank everyone for joining the call today. Thank you to all of our workers. We are going to give more details about the upcoming campaigns that Mark mentioned in the next couple days and weeks. And again, Abraham is going to send out a recording of this call afterwards, and I will turn it back over to Mark for a final word.
Well, I was just typing a thank you to John again. Look, we're not trying to be difficult about this. We really aren't. Look, I've got a research document on my desk now that basically says what I had said to all of you, and we'd be more than happy to provide it to each and every one of you, that talks about that if people would wear the mask, that we could eliminate the virus and 80% of the transmission that's available out there. And this is not, look, this is not me saying it. It's research scientists, in fact, we're going to have one of the scientists that puts out the Lancet, which is equal to or as good as the New England Medical Journal, that is signed on to the Masks for All group, and is one of the leading folks that have been saying all along that this is a way that we can get control of the pandemic. Look, we could open our economy back up if we would do a few things together. Now, I know that sounds like Pollyanna, but we can do it. It will take a lot of you, though, to change this from a narrative about it being political to it really being a public health issue. And I do want to thank the work that the media has done up until this point. I want y'all to understand how much we do appreciate the opportunity to describe what has happened to our members, whether or not they've been in packing, or they've been in food processing, or they've been in retail, or they've been in nursing homes, or healthcare facilities, or pharmacies, or the other units that we represent. I do want to thank you for that. So if there's anything that you think that you need in order to write a better story around this, we'd be more than happy to either connect you to our health and safety people, these scientists that we're talking about, because we're not just making this stuff up. So I want to thank you all for being with us today. And most importantly, I want to thank Stephen, Kristen, Raquel, and Deb for your, staunch support of your fellow members, because the fact that you're speaking on their behalf is going to have a positive impact on what happens back in these stores. So thank you, everybody. All right, Deb. Bye-bye, Raquel. Kristen, I'll see you next at the next appreciation dinner. All right. Take care.